Hey everyone, welcome back. Ready to dive into something super relevant for all you parents out there?
Always ready. What do we have today?
We're tackling bronchiolitis in infants, and I'm so glad we've got Dr. Franklin Fernandez's expertise to guide us. You know, that cough that sometimes sounds a little more serious than just a cold.
Oh, yeah, for sure. Bronchiolitis. It's definitely a common worry among parents.
Absolutely. So for this deep dive, let's break it down. What exactly is bronchiolitis? When should parents really worry? And what can we do to help our little ones?
Great questions. And I think Dr. Fernandez can definitely shed some light on those.
Perfect. So, I always imagine a tiny little cough when I hear bronchitis. But bronchiolitis, that sounds way scarier.
Yeah, it sounds a lot worse, doesn't it? But the itis on the end just means inflammation. So bronchitis is an inflammation of the bronchi.
Right, those are the breathing tubes in the lungs.
Exactly. And bronchiolitis is when those same tubes get inflamed, but in tiny babies.
So it's kind of like the baby version?
Yeah, you could think of it that way. And just like bronchitis can make it harder for us to breathe, bronchiolitis makes it tough for those little lungs to get enough air.
And that's where all that coughing and wheezing comes in that we hear so much about?
Exactly. See? You're getting this.
Well, I do have an almost 2-year-old at home. I've definitely learned a thing or two. But, okay, so we're talking about inflammation. What causes that in the first place?
So in infants, the most common culprit is actually a virus.
A virus, like a cold.
Well, more specifically, a virus called RSV. You've probably heard of it.
RSV rings a bell.
It stands for Respiratory Syncytial Virus. And yeah, it often just causes cold-like symptoms in most kids.
Yeah.
But in infants, and especially those under 6 months old, it can sometimes lead to bronchiolitis.
Ah, okay. So RSV can be a bit more intense for those little ones. So let's say my little guy, he's almost 2 now, but let's say he was a few months old and he starts showing some signs. What would I be looking for?
Well, it usually starts out pretty innocently.
Innocently, okay, meaning like a cold.
Yeah, exactly. Runny nose, maybe a little cough that's dry at first, maybe a fever, but not always. Could be tough to spot, really, in those early days.
Oh, I know that feeling. So how do you know it's not just a cold? When does it become like, oh, this is different? This could be bronchiolitis.
That's the tricky part. Sometimes it takes a few days. You might notice the cough getting worse. Instead of being dry, it might sound a bit rattly.
Rattly?
Yeah, like there's phlegm or mucus in their airways.
Yuck.
Yeah, not very pleasant. And along with that, your baby might be fussier than usual. Feeding might become a bit of a struggle. And their breathing, that's really the telltale sign.
What do you mean, like how they're breathing?
Exactly. You might see their little chest working harder, kind of sucking in below their ribs with each breath.
Oh, gosh. That's when you call the doctor, right?
Definitely. And don't hesitate to call even sooner if you notice their breathing is really fast or if you hear any wheezing.
Wheezing, like, tries to make a wheezing sound.
Yeah, exactly. It's a kind of a high-pitched whistling sound, especially when they breathe out.
Okay. Okay, I'm definitely taking notes here.
And you know what? We mentioned the cough earlier. That's really important, too. Parents often ask about the difference between a bronchiolitis cough and a whooping cough.
Oh, right. Is that the one that makes that scary whoop sound?
Exactly. But don't worry. We're saving the deep dive on whooping cough for another episode. For today, just know that with bronchiolitis, the cough is usually different from that.
Whew, good to know. But still, even with bronchiolitis, it sounds like there are some red flags that need immediate attention, right?
We got it. Like if your baby starts refusing to feed, even their favorite things, that's not good.
Oh, no.
Or if you see vomiting or diarrhea with a cough, that's another one. And definitely, if their breathing ever becomes labored, like they're really struggling to get air, or if you notice any pauses in their breathing.
Pauses.
Yeah, it's called apnea. It means their breathing actually stops for a few seconds. Super scary, but it's a major red flag.
Oh, my goodness. Okay. What else? I feel like I need to write all of this down.
Well, you're already doing a great job.
Yeah.
But yeah, any changes in skin color, like if they become pale or have a bluish tinge around their lips or fingertips, that's another sign to get help right away.
Bluish. That's a sign they're not getting enough oxygen. Right.
Exactly. And finally, be on the lookout for any sudden lethargy or extreme irritability. If they're just not acting like themselves, trust your instincts.
Wow. Okay. Those are some serious signs. I can see why parents get worried.
Definitely. But remember, most babies with bronchiolitis do just fine. The important thing is to catch it early and provide the right care.
And that's what we're here for. So for those milder cases, what can we do at home to help our little ones feel better?
Well, first and foremost, always consult with your pediatrician. They can give you the best advice for your specific situation. But there are some general things that can help.
Like,
Keeping those tiny airways clear is key. Saline drops and gentle suctioning can be really helpful for that.
yeah, the good old nasal aspirator, right? Every parent's best friend.
You got it. And sometimes just elevating the head of their crib a little bit can help them breathe easier too.
Makes sense. Anything else?
Hydration. Can't stress this enough. Offer them fluids frequently, even if it's just small amounts every 15 minutes or so.
Got it. So saline, suction, elevate, and hydrate. Easy to remember.
Perfect. You're natural. Now, in more severe cases, the focus might shift a bit.
Like what? What happens then?
Sometimes, if the baby's oxygen levels are too low, hospitalization might be necessary.
Hospitalization.
Don't panic, it's not always the case. But in a hospital setting, they can closely monitor those oxygen levels and provide support if needed.
And I'm assuming medication might be part of the picture in those situations too.
Possibly, yeah. But again, it's never one size fits all. Dr. Fernandez emphasizes that any medications would be carefully considered and tailored to the individual baby's needs.
Makes sense. Better to be safe than sorry. So we've talked about recognizing the signs, we've talked about treatment. What about prevention? Anything parents can do to help avoid this whole bronchiolitis thing in the first place?
Definitely. And this is something Dr. Fernandez is really passionate about. Early detection is huge, as we've said. But vaccinations play a crucial role too.
Vaccinations?
Yeah, there are vaccines that can help protect against RSV, which, as we know, is a major cause of bronchiolitis in babies.
Right. So important. Anything else parents can do on the prevention front?
Well, especially during RSV season, limiting exposure to crowds and irritants like smoke can make a world of difference.
Good old hand washing too, I'm guessing.
You bet. Can't emphasize that enough.
All right, so much great info today. As we wrap up this deep dive, what's the one key takeaway you want to leave our listeners with today?
I think the biggest thing is for parents to feel empowered.
Empowered, I like that.
Yeah, empowered to advocate for their babies, especially during doctor's visits. Don't be afraid to ask questions. Voice your concerns. No one knows your baby better than you.
Absolutely. You are your baby's best advocate. Thank you so much for all of this. That was super informative. Bronchiolitis can be scary, but knowledge is power. And I feel much more equipped to handle it now.
Me too. Great job.
To all you amazing parents out there, thanks for joining us for this deep dive.